Hey, this is Amelia Carlson. I am a digital content producer with WMC Action News 5, and I'm here with Dr. Patel of the Advanced Dermatology Clinic, and we are going to be talking about the dangers and toxins of skincare products, particularly facial products. So I'm going to turn this over to Dr. Patel, and she's going to be answering your questions that you send to us. So everyone say hi, Dr. Patel. Dr. Patel, say hi.
Hi guys, how are you? Thanks for having me.
So Dr. Patel, let's start off with, if I go in and purchase a product, what am I looking for? Whenever I pick up a product and I turn around and look at the ingredients, what am I looking for?
Well, of course, it depends on what you're trying to address, because you could just walk into any grocery store or pharmacy and there's product everywhere. We're all inundated with a lot of information. For example, if you went into the sunscreen aisle and you were looking for something to protect yourself from the sun, you would want to use products that do not have parabens or PABA in them. You'd want to know what your skin type is like, so maybe you have met with a dermatologist or someone that's knowledgeable in skin, and so they can go ahead and let you know that, maybe you have a little bit of rosacea, so you want to stay away from products that are going to irritate your skin or something that's going to be too harsh. But the main ingredients you want to stay away from are formaldehyde releasers and PABA, parabens. You want things to be fragrance-free if possible, because a lot of fragrances can be really irritating and also get sun. They can be more irritating when exposed to the sun, so fragrances can be irritating for people, their skin, and for those around them. You might know some people that are very sensitive to fragrances. Hydroquinone is a lightening agent that's really popular on the market if you're looking for something to lighten sunspots or discoloration or scars. So you want to use something that's hydroquinone free, because that's found to be very dangerous to people as well. And oxybenzone would be something that you probably wouldn't want to put in your sunscreen as well, that you want to make sure that you're leery of.
So, Doctor, what's the best SPF sunscreen to use for long-term sun exposure?
So sunscreen is broken down into two types. There's chemical blocks and physical blocks. Chemical blocks actually absorb the sunlight and kind of keep the rays from going into the skin. And physical blocks are actually when the sun actually hits the skin and bounces back off. You want to stay with the physical blocks because those are the safest ones for you. That's your zinc oxide and the titanium oxide. You might remember people used to wear the zinc oxide paste on their noses, lifeguards, etc. That you want to stick with products that the sun's not going to absorb back into your skin. It's actually going to bounce off.
So, getting back on the skincare products for a second, and what is the type of regulations that these products have to go through before they actually hit the shelves for us?
So, hardly anything. So, we're really, really lucky in the United States. We have the Food and Drug Administration, or the FDA, and they regulate everything that is prescribed and everything that's out there. But when it comes to skincare and cosmetics, there's very little regulation. Now, they make sure that we're not putting super harsh toxins on our skin, but there's a lot of ways the manufacturers can actually go around and reword it. You can see how one product can be named 6 different things. If you've ever had a skin allergy, we give people lists and there's 7 names for the same product. So we want to make sure that if you know you have an allergy, that you know you're not getting in touch with it, but you want to make sure that even if it says organic, you can say that it's organic, but that means only maybe 30% of the product is organic. The rest of it can be chemical. So you want to make sure you kind of check out the product and make sure that if it's got a lot of words that you can't say in the back, and maybe even be savvy enough to have your phone and Google what some of those things are, then I'd be leery of it, because a lot of those are preservatives, and we have to put preservatives in products so they don't rot and grow bacteria and fungus while they're in the stores. But some of those preservatives are not good for us over a long period of time. So that doesn't mean that your cream or your product is going to give you cancer, but that means that preservative is in your soap, in your shampoo, in your toothpaste, in your lotion. It's in everything that you use. You could be exposing yourself repeatedly to the same preservative throughout your lifetime. Now you've increased your risk.
What are some ingredients and products that you would look for to treat acne, particularly for teenagers, and some bad cases like that? Without naming particular name brands, what are some things that you would recommend for them to look for?
to stay away from, or to
to look for? What are the most effective things to look for?
Well, we're all familiar with benzoyl peroxide. Now, there's a lot of hype about benzoyl peroxide as well because it is an acid and a bleaching agent in the skin. But low doses of benzoyl peroxide, and you'll see that in the Clearasil and the Oxy products, is helpful because it actually kills bacteria on the skin. Salicylic acid, used in very mild forms, is a great exfoliant, and that can be really helpful as well for acne.
So, what are some of the dangers of these toxins that they put in the skin creams? What is the hype about it, and why should people be concerned about it?
I think, like I said, these parabens and formaldehyde releasers and even certain fragrances can, when exposed over long periods of time, the data has been kind of wishy-washy. So we know one thing in life. The incidence of all kind of cancers is increasing. And we know one thing, that we're watching these statistics grow. And we're using more and more chemicals than we used to over a long period of time. So with the human body being exposed to so many chemicals over such a long period of time, we are increasing our risks to environmental risks. So, for example, certain chemicals have been shown to affect fertility, or, certain chemicals can show over a long period of time to increase the risk of skin cancer, even though we might be using it to decrease the risk of skin cancer. So these are things we just have to be kind of leery of.
Barbara asked, how do I get rid of black spots on your face?
Dark spots on the face come from, depending on ethnicities, come from different sources. Lighter skin patients tend to get dark spots after getting a lot of sun exposure, and they're related to freckles and sunspots. And then darker skin patients like myself, I get dark spots after I have a red spot. It's called post-inflammatory hyperpigmentation. There can be treated in two different ways. In lighter skin patients, that pigment's kind of sitting right at the top. So the way we treat it is we kind of slough the top, the top layers of the cells off, and we treat it with lightening agents. And with the darker skin patients, we're a little bit more aggressive. We use lightening agents, but we use a little bit more of exfoliation and maybe more chemical peels and things to help exfoliate that deeper pigment off.
And Darlene wants to know, what can you use for bags under your eyes?
So people get bags under their eyes for lots of reasons, not just because they're tired. It can be genetic, which means that the eyeball and the fat underneath the eyes is genetically predisposed to look a little bit more indented. We can have internal disease. We could be anemic or have thyroid disease or diabetes. There's certain diseases on the inside that can make our eyes and the appearance of our eyes look a little bit different. Over time, the skin gets a little bit saggy on the top and lower lids. So a lot of times, depending on what we're seeing, and that's why it's nice to kind of see a dermatologist, we can kind of guide you in the right direction. You can start with an eye cream and something that's going to tighten the skin. There's fillers. Those are products that we inject under the skin to get rid of the troughs or the deep circles under the eyes. And then there's surgeries and tightening procedures that actually help with the skin and the wrinkling.
What about eczema?
Eczema is, by definition, is a condition where the skin is inflamed. Eczema means that the skin is exposed to the air, and just like little paper cuts in the skin, the nerves are exposed to the air and it itches and burns. So people get eczema for lots of reasons. There's a condition where there's atopic dermatitis or a genetic predisposition for eczema, where people are born with the inability to retain moisture. So we say moisturize, moisturize, moisturize. People with eczema might have thyroid disease as well, or diabetes, and that is when the skin breaks down its ability to repair itself, and so that top layer creates those little cracks, and that's why people get the burning and itching. But the treatment generally is calm the skin down, and one way to do that is to fill those little cracks on the surface with an emollient, kind of like cement in the cracks of the surface. We have a great eczema balm called Bump to Baby, which is helpful for that. It's not a steroid. If your eczema gets super bad and it's so red and itchy it needs medical treatment, a lot of doctors will sometimes prescribe a steroid cream to kind of calm the inflammation down.
What can you do about eye troughs?
Tear troughs.
Oh, they said eye.
Yeah,
Sorry.
so exactly. Eye troughs, tear troughs. Just like we mentioned a little bit before, the treatment of tear troughs is to disguise them. Now we're doing a lot of fillers into the tear trough area where we actually fill that trough area and bring back that cheek volume up to where they're not as noticeable. If there's a lot of laxity in the skin, and the bubbling or laxity of the skin before you get to the trough area, sometimes we will do a blepharoplasty or a removal of the skin to tighten that skin up as well. There's some lasers that you can use to tighten the skin, and then we have a really great eye cream, the Visha Skincare Eye Cream, which has got caffeine and hyaluronic acid, which tends to smooth the skin as well.
What is the treatment for deep cheek wrinkles?
Deep cheek wrinkles. So wrinkles in the cheek happen in two areas, and a lot of times it's from a lovely thing called smiling, so there's nothing really wrong with it, but over time what happens is we get these nasolabial folds. These folds can get deeper over time because we lose facial fat and the collagen in the skin starts to get a little bit more lax, so we notice a little bit more jowling. Then also as we smile, as you can see on me, we get lines in this direction as well because this collagen's also becoming a little bit more relaxed, and we get the lines, these deeper wrinkles in the side area. So if we're talking about the nasolabial folds or these marionette lines, we usually start treatment with fillers. So fillers come in different flavors, and that gives them different prices, which means that we inject a product into the nasolabial folds and the marionette lines to give you back the volume. These lines in this direction are usually treated better with a machine called an Ulthera or a filler called Sculptra, but Ulthera will actually tighten the collagen and lift in that direction, and that seems to be helpful.
So talk a little bit about some of the things, like what would be your top 5 toxins you would tell people to look out for in a skin cream?
I would say sulfates. Sulfates are made in products to make them foamy. They're bad for the environment, but they're also bad when used on the skin over a long period of time because they're highly irritating. And we tend to use them, they're in our shampoos, they're in our soaps, they're in our conditioners, they're in everything that we could need to make anything sudsy. So I would say sulfates. Parabens are from formaldehyde releasers, which exposed over a long period of time are quite harmful and they mess up our endocrine system. Fragrances because they can be irritating, but also in combination can, to us, but they can also be irritating to other people. So some fragrances can be toxic depending on where they're derived from. Hydroquinone, a dermatologist's favorite for years, is a lightening agent, a prescription lightening agent called hydroquinone. It's known to have a side effect called ochronosis, or irreversible darkening now, and a lot because it became so commercially available. It's outlawed in the whole Europe and the UK, and it's not available in Texas and certain states in the United States as well. So we're trying to decrease the ability to get hydroquinone parabens, sulfates, fragrance, and hydroquinone. I think those would be my top 4. Maybe oxybenzone and PABA. Those are things I would stay away from in sunscreens. And Neosporin or neomycin. Dermatologists generally don't like neomycin because it's the #1 contact allergen.
What about coconut oil using on your skin or on your face?
So coconut oil is a great emollient. It's one of those products that you can use to fill in those cracks that we talked a little bit about with eczema. Some people can't tolerate it, is the problem with coconut oil. I find that it's generally well tolerated, ingested. So when people eat it, they're getting a really good, healthy fat. It's used in weight loss. It's kind of one of those lovely products that has a lot of uses. But some people who put it in their hair can get more dandruff because it feeds the process that's causing the dandruff. And when used on the skin, on the face, a lot of people can get breakout. They tend to break out.
And what about like the typical, baby oils, mineral oils? How good are they?
Baby oil is great for babies. And mineral oil is great for, I guess, certain uses as well. It's quite occlusive is the problem. So these oils occlude your skin. And so if you do have chemicals on your skin from your other products that you're using with sulfates, you're just smashing those chemicals back down on your skin and not letting your pores breathe. But some people need it. Some people need that type of emollient. They need the ability to trap in the moisture. So not all products are bad for everyone. I think there's definitely unsafe ingredients that we mentioned. But for some people, they prefer to use baby oil and mineral oil. I find for moisturization, it doesn't last as long. It gets on your clothes and comes right off. But some people like it. I use baby oil to take my mascara off.
What's your one piece of advice that you would give anybody looking for, for the first person choosing a skincare cream? Like a facial cream. If I'm going and it's the first time I'm choosing a facial cream, what would be your one piece of advice?
Know what you're trying to correct. A lot of times people go out there and they buy anything over the counter and they say, I've been using this cream and it doesn't work. What were we trying to do? Were we trying to lighten dark spots? Were we trying to help with fine lines or wrinkles? Is there a product like the Advanced Correcting Serum that can do all of these things for you? What are we trying to correct? And then target that according to your ingredients. So if you're trying to help with fine lines and wrinkles, you might want to go with something with retinol in it, vitamin C, niacinamide, some sort of peptide that's going to help exfoliate the skin and kind of give you those antioxidants to help. Alpha hydroxy acids are helpful as well because they can also cause some exfoliation. The exfoliation in wrinkle creams is helpful and important because it tricks your skin into thinking it's a little wounded, and that boosts collagen production. So that increase in collagen production is what helping with the wrinkles. So know what you're trying to address and then target. And I blog about it, or you can come and see us at any point, but happy to teach people what to look for and what they need to get. I find that 9 times out of 10, people are sold products with lots of hopes of things changing and things getting better, and they end up being disappointed because maybe the expectations didn't fit with what was going to happen. And so, and also they get sold these long lines. I don't want to say the name of certain brands that people sell to each other all the time, and you're forced to buy something because your sister sells it or your aunt sells it, and you buy all this stuff. There's a lot of buyer's remorse there because maybe that's not what they really wanted. Maybe they wanted something just to tighten up their neck. Maybe we needed to be a little bit more specific and a little bit more cost effective.
Well, WMC Action News 5's Jerica Phillips has more with Dr. Patel in 4 minutes at 5 o'clock on WMC regarding skin creams and the toxins and dangers that you need to look out for in 4 minutes, starting with Joe and Kanji. See you then.